isn't the best place to find a lover, so the bar is where I go.
Hi, today I'm going to really quickly go over a few generic points about the way I like thinking about most ocular diseases as a student and as a practitioner, because this just seems like the easiest way to make sure that you've covered everything and you won't be stumped by any questions from examiners or patients. Now, before I get started, I want to make sure that you guys know I'm not actually going to go through any specific disease, so if that's what you want, there are other videos you can watch for that, but this isn't one of them. Let's get started. As with any disease, you need to be able to diagnose it, explain it to your patient and answer any questions that they've got, and manage it appropriately. When you're diagnosing something, you need to know three main things. Thing number one is, what is the condition? So you need some background information on it and what ocular functions it affects, etc, etc. Thing number two is, who does it affect? Knowing the demographics of a disease is going to help us a great deal in primary care practice because it makes things simple for us. We can cut out so many possible differential diagnoses by knowing what to expect in which type of patient. So for example, let's take a patient who has had a large cyl change. It helps if you know that you're best off looking for keratoconus in a young patient, but say in a 70-year-old, it's more likely to be something like a cortical cataract that is causing the change. The third thing is what signs and symptoms to look for, and which investigative techniques to use to see those signs in the best possible way. When you're explaining the disease to patients, it helps if you could imagine if you were the one that was diagnosed with a condition that you didn't know anything about, and ask yourself, what would you want to know? So start with the obvious, what is it? You want to describe the disease in layman terms. So instead of saying, keratoconus is when the retinal image is distorted due to irregularity of either the cornea or the lens and can either be myopic, hyperopic or mixed astigmatism. The regular type of astigmatism is easier to manage than the irregular blah 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 blah. You just say something like, keratoconus is when your eye is rugby ball shaped rather than round like a football. You'd also want to know, why has this happened to me? So you tell them about the risk factors, how it starts, about the etiology of it. They'd want to know what's going to happen to me now. So you tell them about the disease course. You need to know about the disease course and the prognosis of that disease. And what can we do about it? So you need to know, is there anything that the patient can do to help themselves? Is there a treatment or a management plan that you should be following? What are the next steps? For management, there are four main things to think about for most diseases. And these are there any further tests that I should do? So is dilation required? What about visual fields tests or colour vision tests, etc, etc? Do I need to refer for this condition? If so, then to whom and how urgently do they need to be seen? So do they need to be seen by neurology, ophthalmology, an orthoptist? Is it going to be a routine, urgent or emergency same-day referral? If I'm not referring, when do I need to see this patient again in primary care practice? So is a 2-year recall sufficient for that condition, or should I decrease that to a 12, 6 or even a 3-month recall? What appropriate advice can I give to this patient? Do I need to give them an Amsler grid to self-monitor? Do I need to advise them of the possible progressive symptoms of their condition and tell them to return or see the hospital if any of them become apparent? What do I need to tell them? And that's all for this one. I didn't go into any particulars about ocular diseases. It was just a blanket rule for the diseases to be broken down step by step. Hope it helped. See you later.